So we are at the clinical application of longevity medicine 2026 in the beautiful Fort Lauderdale, and I have the beautiful Dr. Robin Rose here with us today. So Robin, you are so passionate about so many things, but I think a common theme and a common question that we've seen a lot throughout the entire conference is continuing to relate back to COVID. And so talk through a little bit about where that passion came from, because again, you did so many things prior to COVID. What kind of sucked you into that cycle?
So I got super obsessed with COVID before COVID hit. I would say around January of 2020, we were following it. My husband at the time, he had a lot of clients in China, was doing a lot of work there, and they were sending us like videos and pictures of what was going down there. And we were like, shit, this is coming here, right? We're like, this is coming. So I was like starting to research and look at things and da-da. And then like, I would say the very beginning of March, like March 1st, 2nd, I had a trip planned for like work around like, I was going to visit another functional medicine clinic because I was about to take the big leap from conventional to doing functional, like actually leaving and practicing because I had already done all my certifications through IFM, like you. And I was like so afraid to go because I like knew it was like coming, you know? And then literally the week after I got back, I went on the trip. I like wrapped myself like in my scarf. I didn't touch anything. I was just so nervous. And literally it started like week to 10 days after I got back. And literally I want to say 4 days after I got back from that trip though, I got really sick and I don't really get sick. And they wouldn't let me go back to work because I was still sick right when the pandemic sort of hit. So I was like stuck in my house. So now I'm like thinking I'm going to die of COVID. I'm literally on every webinar, like looking everything up, like watching world-renowned virologists from all over the world, like try to understand like how do you combat COVID, right? And like figuring out through like natural ways, compounds, things like that. And I literally sat at my dining room table for I want to say 18 hours a day, like scouring like the internet, like every, you know, all like the PubMeds, like every article I could get my hands on to try, and I wrote a primer. And like nobody, I mean, still no one knows really, but like no one definitely knew me at the time, but I was like, I'm going to put this on my like website and I'm going to like write this primer on like all the different things that you can do to like help prevent COVID or if you get it, treat it. And it was like everything from like melatonin, quercetin, curcumin, you know, all the different all the different polyphenolic compounds, like all the things, vitamin D, all the things that we knew, but like we weren't, you know, zinc, with quercetin, all those things, you know, and like I just cited the articles, explained why it worked with COVID, and that's how the obsession started.
I think one of the most interesting things is we're still learning about it, and here we are, you know, so many years later. Do you find that there is a high? Because I know you do the ultimate, you know, workup, sick medicine. Do you find that there is a correlation with patients who have like underlying Epstein-Barr, underlying mold, underlying Lyme's disease? Do they have a higher prevalence of a co-infection, and then COVID is kind of like what reactivates it?
Yeah, I think that, you know, someone has that, like that terrain, that foundational terrain, that they're a setup for it, right? Like anyone that has issues with like significant dysbiosis, like leaky gut, you know, underlying, even smoldering autoimmune stuff, you know, a history, right, of mold toxicity, Lyme, EBV, any of those things. Although many of us have had EBV, so that's just like one of those bugs that gets reactivated because of the immune exhaustion that happens post-COVID, right? But in general, there's sort of this blueprint of a person, but then you also have all these people that are so healthy. And what I think is like we live in a toxic soup. Right? We already live in a toxic soup. And I think so many of us are living right here, like right at that threshold, right before that last drop in the bucket sort of spills over. And COVID was that last drop in the bucket for so many people, right?
Yeah, absolutely. It's like it just threw them over the edge. And now that it's hard to come back from that. So as practitioners have come to CLS and have come to Calm, what would you say is, you know, that first step in working up that patient? Because you are brilliant. You talk this all day, every day, and I've heard you speak multiple times, and I'm like, I don't know, we're just going to refer that out.
So I think you have to, first take a really good history, right? Every really good doctor, like all of us, you have to really sit with this patient and build a timeline, right? And you'll notice that when you take their history and ask them, I mean, you want to get everything back to when they have had, mold exposure or Lyme, and their full
Right.
history, but then also more recently, like building that sort of timeline around when they got vaccinated
Right.
or had exposures to COVID. And you'll see that more often than not, the vast majority of the time, there's like a temporal relationship between when their symptoms really started
Sure.
to explode, right? Or they had sort of smoldering or low-grade
Yeah.
symptoms and they exploded. There is a temporal relationship between exposure to the vaccine or
Yeah.
the virus or the combination of,
Yeah.
you
yeah.
know?
No, that's fascinating. What about, so one of the things that we do, and
Yeah.
we've talked about this, that I get to do in practice is, I do aesthetics.
Yeah.
And I've also
love
gotten
that.
to train with Dr. Suzanne Faree in neurotherapy.
Yeah, yeah.
But one symptom of
Yeah.
lingering COVID is anosmia that I've seen,
Yeah,
and I've had now 5 patients that I've brought it back by using neurotherapy.
I knew that.
Yes. Yes.
Did you
So-
go up the? Did
no,
you,
so
yeah.
I actually inject it into the
Yeah.
sinuses. I inject it into the sinuses.
And really, so you didn't have to go up
No,
through
no,
the olfactory.
Yeah, just straight into the side. And I would inject it like I would do just a normal injection, 30 gauge needle, aspirate back, and I let them sit for 20 minutes. 20 minutes later, I come back with my essential oils. I'm like, smell this, and their smells
is
back.
so
I don't know if you've
beautiful. I
gotten to
wish
see
you
that
would've
yet.
told me
I
that.
know. I
That's
wish
so
I did one last
great.
week, and I'm so mad that I didn't record it. But
Oh my
just
God,
curious
yes.
if you've had that. If not, I highly encourage putting that.
Our nurse practitioner, Train Health, she is actually doing a ton of neurotherapy,
Okay.
but she's going down to
Oh,
train with
perfect.
Suzanne
Yes,
to get this
perfect.
more advanced there
Yes.
because she wants to do more of the blocks,
Yes,
the
yes.
stellate ganglion
Yeah,
block,
yeah,
like all the things you
yeah.
were talking about on the
Yes.
stage earlier. I think that plays such a huge
Yes.
role in all
Yes.
these patients,
Yeah.
and I love that type of treatment,
Yes.
especially for
Yeah.
the severe autonomic nervous
Yes,
dysfunction,
yes.
like the dysautonomia.
Yeah.
It's huge,
Yes,
huge to
absolutely.
reset them.
Yes.
So I love that.
Robin and I are very fortunate to get to work with New BioAge and that we get to call many of these amazing practitioners friends of ours,
Yeah.
and we always can continue to learn from each other. And this is why attending conferences like this, doing panels like we do, sharing clinical cases can be so important. So thank you, Robin, for letting me
Thanks,
interview
Lexi.
you, and it's been great.
Yeah, thank you.